I'm from Japan. I went to acupuncture school in Japan first 3 years, and then came to the United States and study actual training in Alabama at the Troy University, and then get the acupuncture actual training license in there, and then got the internship position with the Rays 2014, and then work for the minor league like 5 years, and while I'm working full time and go to acupuncture school about 2.5 years and got the board exam, full exam, and it took 1 year. And then promoted to the big league 2019. And then since then, I'm with the big league. This is my sixth, seventh year. And then my title is a major league associate trainer slash acupuncturist right now.
Cool.
Perfect.
Uh, that's
Awesome.
awesome. Have you so the Rays are the only team that you've been with?
Oh yeah, that's it. Yeah, I did a
Yeah.
couple internships with the Washington Nationals and Arizona Diamondbacks, but the only two teams I know like outside the race. Yeah.
Gotcha. So like in your opinion, since you obviously took my class, like what are the primary differences between the way that I do stuff or the way that I teach stuff and the way that you were taught stuff over because you learned in Japan, is that correct?
Right, that's correct.
So what are the biggest differences in your mind?
So to me like a dry needle is just a local like muscle trigger point release with a needle, but for the acupuncture I also do it like a trigger point release with a needle, but I also use for like a meridian or acupuncture points for like I want to maintain homeostasis, which means like these guys are always active, 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 which means like sympathetic nervous system always active, right? So I want to calm them down as much as possible. So trying to activate parasympathetic nervous system, like using like more hands and foot and knees, and then I use a needle on the head too. So trying to calm them mind to relax them to get more recovery quicker. So to me, like between a difference between acupuncture and dry needle is like using acupuncture points or like a local muscle trigger points. I think that's the easiest way to explain now. Yeah.
And then like so I guess the meridian system is so there's 12 major meridians, correct? There's
Right. That's
six
correct.
yin and six yang meridians.
Right.
So traditional acupuncture, the way that you go about it is based off of regulating the autonomic nervous system through balancing the meridians. Is that correct?
Yeah, that's correct. Yeah.
So the way and then the way that I think about it, and this is why I love acupuncture so much, is because like we went over how to needle the ear and stuff in class, and like I never really even heard, like I was never taught this in school, that the vagus nerve innervates the ear. And like when acupuncturists developed these ideas thousands of years ago, nobody like really knew what nerves were or anything like that. So they were just seeing this cool cause and effect, like, hey, poking somebody in the ear with this sharp thing like seems to help. And what they were
Mhm.
actually doing was regulating the autonomic nervous system. I just think it's
Right.
so cool because physical therapists, and I try to learn more about this all the time. Like we just had another acupuncturist in our classes last weekend, but you mentioned like regulating the nervous system with the hands and the feet and the
Mhm.
knees and
Mhm.
stuff like that. In physical therapy land, we are not taught to think like that at all in school. Like you said, most physical therapists are just taught target trigger points, relieve the muscles, and that does help regulate the nervous system, but it doesn't work nearly as well, I think, if you add your type of thinking into it and say, okay, we that helps also, but we also need to think about targeting the nervous system directly. And
Mhm.
that's where acupuncture is so cool because that's the general, like in my mind, the meridian system was just kind of it's just a good alternative explanation for what we call the autonomic nervous system today. I think they were trying to get at the exact same thing, right? Yeah, I think it's, so. When you mentioned to me when you were treating your the pitchers and stuff like that,
Mhm.
you have like a
Mhm.
protocol that you do with them using certain points and meridians. Could you explain that to me and just kind of like your methodology with how you think about that?
So I use for the pictures like for the acupuncture points right now is I use a River 3. which is like for the ankles and foot, and then SP3, SP6, and then stomach 36, which is a knee, and then I use a LI4. These 4 points we call it 4 gates, and then this is like a very traditional like basic acupuncture points for like everything. So if you put there, you are not gonna go wrong at all. Like
So what when you what the gates what because I've heard that mentioned before. I have no idea what that means though.
I don't
What
know
gates?
why it's called the gate, but there's a 4 points using the four points. So I'm assuming these points for like a gating for opening up the gate for the meridian stuff. So
Gotcha.
I think that's why they call the 4 gates instead of 4 points. You know why?
Gotcha.
So I always put these points for before I put any needle for the trigger points too, and then trying to calm them down. And they are always active. And then sometimes like relievers, like yesterday, pitching the game, and then they got so much stress and active going on, and then I put the needle there instead of just doing the local points needle, and just kind of meditating. Just lay down on the bed table and then put the full needle there and then put the one needle here to just meditate like a 15-20 minutes. And then do you guys know OOP wristband?
Now, oh, the whoops?
Yeah.
Yes.
So they can see how much sleep they can
Hmm.
that like quality sleep, how many
Mhm.
hours they sleep. You can see on the app, right? So he realized it I before and after needle, like they like he didn't do needle, like he slept like 6-7 hours. But even they after pitch, like usually these guys cannot sleep after he pitch because
Right.
they got so much going on in the head. So they usually like a sleep quality is super down after they pitch. But this guy realized it after needle that day, his sleep quality much better than like even like he pitched that day. So he actually see the benefits to use just a needle like a 4 gates needle and then here and then coming here his mind and then increasing the sleep quality, which means recovery quicker. Get ready for the next day.
100%, man. That's one of the coolest things about needling that I've seen over the last 10 years that I've been doing it is like it seems like almost without trying, a lot of people will, even if they're not coming to you with sleep problems, which I don't think is like the reason that you were needling him either, but it's like look at how much that and that is such an obvious um an obvious objective thing to see. It's like we know that better sleep requires your parasympathetic nervous system to be on more. If your sympathetics are on too much, you got too much epinephrine and stuff floating around everywhere. And when you like if especially for the pro athletes that you're treating, like if you don't get enough sleep, there's not enough brain-derived neurotrophic factor that gets released and all the stuff that you guys learn about in the Eastern medicine and why that's so important. I mean, it's impossible to be physically healthy if you're not getting enough sleep.
For sure, yeah. So
That's
I'm trying
awesome.
to, create more quality sleep. Like to me, still believing like a sleep is the most important recovery method.
100%. Yeah. I
If
man,
you can do
I
the
always
thing.
think back to when I played hockey in college. I so wish we had athletic trainers and stuff, but we never, I mean, we didn't have anybody that did acupuncture or dry needling or anything like that. The first time that I ever got acupuncture was when I was playing hockey. I think I was like 19 years old. And I'll never forget it because there was this super hot Slovakian chick that was giving me acupuncture. But she would like describe similar stuff to you. And I always used to get a groin strain, like constant left groin strain. And she needled me one time and I never had it again. And that was like my first experience. And it was with acupuncture. So yeah, it's so cool. Do you know, Shin, do other baseball teams have people like you that are treat their players or
Padres have an acupuncturist too, like me. He's a ATC acupuncturist in the United States. He's Japanese too. And San Francisco Giants used to have a acupuncturist, but he's retired now, and he's back home. And I think he opens up his own clinic. But now, I think Coral Rockies too.
but
Hmm.
I think he got acupuncture license in the United States too. So like now probably like three Japanese acupuncturists working for the Major League Baseball right now.
Cool.
Nice.
Cool. Yeah, I'm always surprised. Like I just initially thought when I first started teaching dry needling that like all the pro teams would already have people like us that would work for them already. And it seems like way less than 50% of the teams actually have somebody like that.
Right,
And
right.
it's
And some
so
of the teams just like out coming from outside. So just a
right.
home games like a couple days a week and something like that, but not like a full time.
Not a full-time person. Yeah, I think it's crazy. I think all those it would just be so much better for the players and stuff
Mm-hmm.
like that. That was one of the cool things, man. The Pittsburgh Steelers sent us a bunch of their athletic trainers to learn how to do needling, and that was the reason they were like, our players are going outside of our system to go see individual. And as you know, like major league teams don't really like that for you to go outside your own
Right,
medical
right.
system very much.
Yeah.
So yeah, so more and more teams are picking up on it.
Mm-hmm.
When So how do you use the ear, Shin? Because the few things that you told me when I was talking about it, so I think about the ear in terms of the vagus nerve innervates, like the concha, the symbiconcha, the inner part of the ear, and the vagus nerve is the primary nerve of the parasympathetic autonomic nervous system. So I want to stimulate that because that reciprocally inhibits the sympathetics. You mentioned that the ear is it outside the meridian system or is it utilized slightly differently? How do you think
This
about it?
is just like a micro body in the ear. I
Like a
actually
little like a little homunculus in the ear?
yeah, like this. I have a picture now.
Ah, cool. Yeah, I've seen that picture
I
before.
So
still have that photo from class.
yeah, right,
Yeah.
yeah.
Yeah, yeah, that's right. Yeah.
Yeah. So this is like a to me like a completely different method. So you don't have to think about the meridians and all that shit stuff. But this is just the points where you want to put. And I think I showed you to this book too, like all the protocol.
Yes, I have a
Yep.
picture of that.
So
Yep.
I use like I don't use much anymore right now because reason why I was using this for like a more like a mental disorder guys.
Mm.
Uh-huh.
So these guys like so much pressure on the game and they can know like thinking like a negative thoughts all the time. So this I was using this guy for the years all the time. And then he played so good and he made All-Star that year. And then he hit almost like 40 home runs something like he's really, really good. But he got traded to the other teams and then he loves fishing, but he couldn't do fishing with the other team. And then he got like actually mental disorder and he couldn't play any at all.
Oh man.
Yeah, so
Damn straight. What is wrong with those guys, Shit? You take away a guy's ability to fish and it fucks you up forever. Like
yeah,
you'll never be able to hit a
right.
baseball.
Yeah, he never came back to the Major League Baseball
It's
anymore. Yeah.
horrible.
Wow.
That man, so did he notice the specific correlation between the ear needling and his
Oh,
mental
yeah.
health?
He asked me all the time to do a needle. Yeah. So we actually
Man,
put the
that's
like actually use like a small needle, like a little hurts, but stays longer and it more stimulates the nervous system. So
the one
he
with the
was like
little
more and
like the
more.
Band-Aid tape on it.
No, use them like a actually super tiny needle too.
Oh, the like the mint like the micro acupuncture
Like
needle
kind of
things.
like
Oh,
yeah, piercing type kind of stuff. But
And you
gotcha.
just leave that in.
yeah,
Yeah.
kind of like I put the band-aid on it too, but actually we use like super tiny needle in that spot.
Yeah, it's like
And
a 1 millimeter needle or something.
right, yeah, yeah.
Oh,
Yeah.
cool. So,
And then
man,
yeah, he loves it.
I know in acupuncture, they think about that. You guys think about the mental health side of it a lot. That's one of the biggest like reasons that I see that people should be needled is because of the mental health effects that it has. And then obviously that has a reciprocal effect, just like on that dude. He started hitting a bunch of home runs and played better. Do you, when you did this prior to the Major League Baseball, did you work in like a regular clinic somewhere, or did you ever?
No, I
No,
never worked for like any like a clinic or anything. Yeah.
gotcha. That's one of the things that I think it should really be used a lot more for like high school age kids and just regular people and stuff, specifically for the mental health aspect of it. And if you can combine both things together, because man, like it has, because we needle people all the time, I see it all the time. So it's like easy for me to believe. It does seem kind of crazy though, I guess, for like a regular person. If you're like, hey, I can poke your ears with needles and make you feel it, people are like, what the fuck are you talking about? You know?
Yeah, sure.
So if you had to explain it to a regular patient, Shin, about the ears and the mental health, how would you describe that it's helping their mental health? Because this is
I
something that I
think
always
just
struggle with.
yeah, I think just show them the picture and then this is what's going on in the ear. And then I also show them the protocol too. And this is what we use. And then this protocol helps in other people, like any like internal issue, the diarrhea or headache or anything, like so much protocol in here. I'm gonna just show them this is what we use, and then they start to believe and trust me. And then hey, let me just try, and then I just put the needles on the ear and stuff, and then feels good later. So they start to believe me more, and then I think that's the way. Yeah, just explaining like using the picture and books and not just like doing it. Hey, this is that's for. I think it's showing the picture and stuff is like a most easiest way to get the trust and explanation to them. So yeah.
Do any of the pro guys, are they ever like, get the fuck away from me with these needles? Because I definitely like, I know some of my pro athlete friends are like, no way, dude, I don't want you anywhere near. But I always try to explain to them, it's like this is so important, you guys, just for your nervous system. And with the pro guys, I think it's easier because you can explain like, hey, this is gonna like improve your ability to hit the baseball or
Yeah,
whatever
yeah,
other sport they're doing. But yeah, that seems to be like the only way that you can really convince regular people, is like you said, is just get them to try it once, and the feeling that they get is such an obvious change that then
yeah,
once they start to feel it, they're like, oh man,
yeah.
this is really working, right?
Mm.
It's
Well,
so
and
cool.
one question that I had was when we had worked with the football guys, we had talked about, and with Josh, we had talked about their response time with fast twitch and things like that. Have you seen any differences in people who get needled before or after pitching or anything like that?
This
Or
is to me like just the needle feeling good, just a trigger point release, no like fast twitch or
okay,
not activating stuff. To me just loosen the muscle, less fatigue. That's why they can like perform better.
yeah, okay.
That's to me, yeah.
Because we were curious for one of the people was going to go work at the combine in the NFL, and we were curious if anyone would get needled before running the 40 or before
Dude,
doing any of the things, and then after,
Shin, this
and
would be
if there was any difference.
yeah, Shin, if you have the chance or the ability to do this, that would be such a cool thing to be able to show, because like scientifically it makes sense to me that this would be happening. But like Ryan said, if you could show like you take a picture, you do some needling, but before you do the needling, like you with a speed gun, which is very objective, like you just measured their average fastest fastball or whatever, and then you needle them, and then you have them do it again. And if you could show, like even I would think like a 0.1 mile an hour difference would probably be a big deal in the major leagues. I'm sure that
Yeah.
happens. I just don't think anybody has ever looked at it.
I don't do needle like before they perform at all. Like it makes sore a little
Oh,
bit.
so that's a really good question. What is your protocol for that as far as how many days do you give your players before they have a regular game?
So this is depends on the guys for sure. But like if the guys like they don't get much sore from needle next day, I do day before too.
Mm,
But most of the guys get sore like 24 hours, which is like it's already game timing next day.
hmm.
So
Mhm.
I don't do needle like I do needle like at least 48 hours before.
Okay.
Gotcha. So
So
get
I
them
wanna
loose.
get loosened up like a 48 hours before the game time, and then loosen up all the muscle, and then next day just feel for it, and then next day like 48 hours later in the game time, and then they feel good.
That makes sense.
But usually like I do these guys now, like I do right after they pitch, like a starting pitcher, like I'm gonna do needle like today, like who pitched yesterday. So this is like a
Okay.
post recovery treatment, like right after they pitch, and sometimes like I do between day three, which is like 40 48 hours before. But
Right.
usually I do like a needle like right after they pitch, like the next day. Because but I get so aggressive with the needle, like I get so much muscle twitch, like I'm gonna like a piston it like till it's not gonna twitch anymore, which
Mm,
causes so much soreness. But they gotta like 4 days, 5 days to recover, so I don't care. Just like get the muscle twitch
right.
as much as I can to like get the muscle like relaxing as much as I can, and then recover next like 48 hours, 72 hours. Yeah, that's my philosophy more.
So Shin, and that makes perfectly good sense. That's like how I would do it more or less. When you is pistoning trigger points and getting them to twitch and calm down, is that something that is an acupuncture thing, or is that something that you've combined from somewhere else? Because when I've never seen what I think, at least in my brain, is a traditional acupuncturist doing that. And I think that's one of the things that's missing from like traditional acupuncture is I love the idea of targeting the energy system and the autonomic nervous system, but to do that as well as you can, I think you definitely have to go after the specific problems in the muscles too. So is that a part of regular? I've never heard of a like a normal acupuncturist
Or
use.
radiation acupuncture doesn't get the twitch
Right.
because this patient gets super sore after needle like a muscle twitch. So patients hate you after like a muscle twitch and a lot. So
Yeah.
they're not coming back to you. So that's why I don't think they do like muscle twitch for like these patients. But to me, like athletes like get the muscle twitch like most fastest and quickest like efficient way to loosen the muscle to me. And then these guys realize it too. Like right after needle and muscle twitch, we don't feel any tightness anymore. So these
Uh,
guys know it even like super sore.
100%. So they're basically going into it knowing like this is going to kind of suck a little bit, but it's
Right.
going to
Yeah.
make my muscles so much better
Yeah.
the fastest possible because
This is like always I'm saying like a no pain, no gain.
a hundred
Yeah.
percent. And that is like, unfortunately, that's one of the harder things to get across to people with needles is like the more pissed
Right.
off your muscles are to start, the more you feel it, the more you get those twitches and stuff. But I mean, when that stuff twitches, it's literally sarcomeres that are just unraveling in real time, and that muscle's getting longer, and there's more blood flow going into it, and the nervous system, the one of the things that I think about a lot of the mitochondria and how like you go from producing just a tiny amount of ATPs per glucose molecule without oxygen in the muscles, and then when you go in a needle and you reoxygenate everything, it like 18x's the amount of energy that tissue can produce, which is one of the underlying reasons why it helps people recover so fast. It just does, it makes you sore. Yeah, for
Yeah,
sure.
yeah, a lot. Yeah. And then I also do a scripting cupping at the same time too after needle.
So you do that after needling?
Yeah.
I always ask this question because I don't know if I always try to figure out like is there a best way to do these things? It makes more sense to me to do it after needling too, but some like Angela who teaches with me, she says she likes to do it before and after. I have a lot of students that say like they like to do it before. I think doing it after makes the most sense too. Um, what other techniques do you use, Shin, aside from your needles?
I use it as just a hands, like trying to calm them down like a body. So even like I'm using needle, but I'm not trying to use needle, trying to less needle as much as possible. So like I used to put so much needle, like 40 needles on the shoulder before like a couple years ago, but this is not look good too, but it's gonna cause so much soreness. And then it's sore next day too. And then because I was not good at it, like targeting the trigger points. Now I got more skills to just touch and feel, and then this is a trigger point, and put the needle, boom, 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 and I can get the twitch now. So I got more skills now in experience. So now I use only like probably like 4 or 5 needles like on the shoulder. And
Mhm.
I was use like one needle and then like put the needle boom 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 twitch and then find another spot and then twitch twitch and then find another spot and twitch twitch. And that's
Gotcha.
caused much less soreness. And then even like next day they don't feel any soreness actually.
Sure. Yeah. I mean, and
And
that
then
makes sense, I guess. Yeah.
yeah. And then so I'm trying to calm the nervous system with my hand. Like I mean learning like a new technique from Japan now. And this guy's also acupuncturist too, but he doesn't use needle. He always use the hand. So his philosophy is like there's a tightness here. Hold on. So his philosophy is like this is like a muscle tightness, right?
Uh-huh.
So this muscle tightness, because it's tight here, it's tight here, that's why it's tight. But if you loosen up here, it's not tight anymore.
Mhm.
But he loosen up this tightness with just hand. Like this is my sensor, right? And then I use like hand like a slide in the skins, and then if it's tight, finger stops. And then
Mhm.
like I'm using 2 hands, so it's tough to do it, show you, but like doing this, and then my finger stops it, and then rotate it a little bit, and then this side is gonna loosen up, and then so my finger stops here, and then rotate it, and then loosen up, and then tightness is gone. So this is actually works, and then I don't know how that works. So I was kind of curious to do it, but I was just doing it, learn it, and then it's actually working now. It's much getting better, and then I'm using like this is my second year now, and then every day I'm trying to improve my skills, and it's getting better and better now. So this is like actually I don't have to use needle, but I can uh, open the meridian also like maybe activating the nervous system too, and then actually like get the much range of motion like without using needle, just the hands. It's pretty cool, and
The
I'm
way
gonna
he
go.
teaches that, is he thinking about using like going along the meridians by with his hands
Yeah.
instead of, oh, cool. That's a cool way to think about it. And
Yeah.
that, man, like I've never heard of anybody doing that, but
Right. Yeah.
that's not is that's I'm gonna start trying to do that. But that makes like, just in the sense of like regular soft tissue and myofascial work, just that general idea makes perfectly good sense. It's like
Mhm.
healthy tissue has enough fluid in it. It's not hypoxic. It's not stiff. And you can like it wiggles around very well. Once you go from like a junction zone from healthy tissue to stiffer, more hypoxic tissue, yeah, you like your finger, if you practice, and it's not super easy to feel sometimes, but if you practice it, you can find those like tight, and then he just uses a rotational technique,
Mhm.
and super cool. I love that. Is that somebody that like teaches in Japan, or is it just somebody that you know over there, or?
He's actually start to teach in Japan. I'm gonna see him in this off season. Yeah, November.
Oh, cool.
I already contacted him and hey, I want to see you, and then he said yeah, it's totally fine. And yeah, I
Are you
was
gonna?
trying to bring him to spring training like for the race, but it was like so much going on with the roof and stuff, and so
Right.
we couldn't bring him. But I'm gonna actually see him to learn from him. Yeah.
Awesome. Cool. I would love, after you talk to him, you got to tell me
Oh
what you
yeah.
learned from him. That's
Mhm.
super cool.
Super cool. Like I don't know how that would work, but it's worked actually.
It, yeah, and man, that is such a, I think it just makes sense to go with needling too, because you're kind of using like the same philosophy. It's like we need to find the spots in the body that is, however you want to think about it, impeding the electricity that's going through there, or has nutrient deficiencies, or the muscles can't contract, or whatever it is. That's super cool. I like that. Is there a name for that, Shin, or is
This is like only Japanese made, but if you gotta translate it, it's gonna be like a pressure regulating method.
what's it called in Japanese?
超圧法.
I'm gonna go with the pressure regulating method, Ryan.
Yeah,
Joe
I can
Watso,
send
come
you
on, we
like
got it.
I can send you guys for that video because I was trying to presentation to the race because like I said like showing them is like I thought this is the easiest way, so I asked them to put the English translation to send it to me the video, and then I send it to the Rays, and then yeah, I got this video so I can show you guys.
Oh man,
Oh,
awesome. I would love that, dude. That would be
Well,
awesome.
maybe I can show you here too. Let me show you here. Let me
Yeah.
I can share the screen here. Hold on.
Yeah. Let me record. Can you share, Shannon? Do
Yeah,
you
I'm
need me?
gonna share too. Hold on.
should be able to request, and then you have to authorize Jason.
Oh, share.
Shannon, are you in Florida right now?
I'm in Tampa right now. Yeah, Rays pay for like a housing stipend, so I don't have to commute like hour and a half from Sarasota.
Oh, nice.
Yeah, which is super like blessed. Yeah,
Yeah,
Yeah.
that is nice.
I couldn't drive like hour and a half every day, so
It's insane. Ryan used to do that for school. Like lots of people do that. I think it's crazy, man. I've never done that.
oh yeah. Can you sh see here?
Yeah.
Yep.
Okay, so here. There's no sound. Yeah, there's no sounds, but I think he's fixing lower back pain, I think.
So that's what he's doing with his fingers is he's just
Right.
feeling for, and he's even
Yeah.
doing it right through the clothes.
He's just palpating where it's tight now. He's fine, like hospital is tightening up.
Oh, he's teaching a course, isn't he?
Yeah. So actually he used the needle here. Yeah.
Yeah, I love that, man. So he's
And then it's not in there, just like just boom, boom, boom.
oh, and he took it out already. I didn't even
It's
see
all
that.
around.
So I'm assuming he's like specifically just waiting for that tissue to relax.
Hmm.
And I like how he flicks the needle to get the extra stimulus in the muscle there. That's such a more logical way to go about, like just instead of like just how a lot of people needles, they're just like kind of just hoping that certain things happen. But he's really like feeling the things change and he's waiting until it changes until he moves on,
Right.
right?
So
Is
he's
this
just waiting. Yeah.
is he teaching? Is this at like a university somewhere, Shin, or do you
No,
know?
not the university. Just he just owns a clinic, and he just start to like co teaching business.
Gotcha.
So I
Does he?
gotta have, yeah, more videos, and I'm gonna send it to you guys, and so you can like.
Yeah, that would be awesome. Does he speak? Does he speak English, Shin?
I don't think so.
No.
This video is like his assistant's actually making it. Yeah.
Mm.
Gotcha.
Yeah, he doesn't know any business, like nothing like that.
Yeah, for sure.
He's an assistant.
That's like most medical people in the US too. It's crazy. Yeah.
Right.
I asked because I would love to talk to this guy and just pick his brain about what he's thinking
Yeah.
about.
Yeah, I'm so excited to talk to him and learn from him like this off season. Yeah.
That's really cool, man. I love how you find people like that to keep learning from. How old are you now, Shin?
I'm just 40 like last week.
40? So almost
We're all like the same age.
yeah, dude, what the fuck? Oh, you just turned 40. I'm turning 42 in like a
Oh
month.
yeah?
Yeah. Ryan just turned 41, right? Ryan, or I always get it mixed up.
Two.
You're 40. That's
Yep.
right. You're a little bit older than me. We're all going downhill. We need to keep up with the needle. Cool, dude. Well, Shin, thanks for doing this, man. I would love to do this again with you. I'm sure I'll have some more
Oh yeah.
thoughts and stuff.